Good morning to all of you. So today we are going to start a new topic, that is hepatitis. Okay. So hepatitis I will be taking in two parts. So today we are going to discuss about hepatitis, basically on what are the types of hepatitis and what are the signs and symptoms, what are the causes, and what are the diagnostic tests. So this is what we are going to study today. Now, what is hepatitis? Hepatitis is a term used to describe inflammation or swelling of the liver. Okay, so whenever we use the word itis, it always indicates inflammation, and because this is inflammation of the liver, so inflammatory changes, we know what are the changes which can occur due to inflammation. The size increases, the local blood supply increases, there will be formation of exudate and all those things. So those all symptoms will be there in hepatitis. It can be caused due to viral infection or when the liver is exposed to harmful substances such as alcohol. Okay, for small children, alcohol will not be the cause because they are not exposed to it. But for small children, viral infection is one of the common causes. So it can be caused due to viral infection or when the liver is exposed to harmful substances such as alcohol. Okay, hepatitis may occur with limited or no symptoms. Sometimes people may not know that they are cases of hepatitis because they are asymptomatic, but often it leads to jaundice, anorexia, and malaise. Okay. So this is a short introduction about hepatitis, where we learn that there will be swelling in the liver. Basically it is of a viral origin, or for adults, if they are exposed to alcohol, then hepatitis can occur, and hepatitis may be asymptomatic, or most often they have jaundice. Jaundice we have already studied 2-3 months before. I had talked to you about jaundice. So it leads to jaundice, and there will be poor appetite, and there will be malaise. Now, what is hepatitis? Hepatitis is a widespread inflammation of the liver that results in degeneration and necrosis. Okay, so here is two things are there. One is degeneration, and second is necrosis. Okay. Now, two things are there. Okay, so whenever there is inflammation, two things will occur, that is degeneration. Okay, so degeneration means it is a deterioration of or loss of function of tissues or organ. क्या मतलब है कि अगर हेपेटाइटिस हो तो लिवर का फंक्शन ठीक से काम नहीं करेगा. Okay, so that is the meaning of degeneration. Degeneration means there is deterioration. Deterioration मतलब कमी आना. Okay, so we know that liver has lot many functions. Okay, there are 10 functions of the liver. So all those functions will not be taking place properly. And second is there is necrosis. Okay, now what do you mean by necrosis? Necrosis is death of a tissue. Okay, necrosis is death of a tissue or a cell, or maybe due to lack of blood supply, or maybe due to injury. It can occur due to disease, etc. Okay, so this is the definition of hepatitis, that if you have inflammatory changes which are taking place in liver, first is degenerative changes will take place. What are degenerative changes? The liver will not be able to function properly. So that is degenerative changes. And second is there will be death of the cells. So this death of the cell is death of the cells will be there. So this will lead to further degeneration of the tissues. Okay. Now we are going to study the other next slide. Okay. Now we have different types of hepatitis. Okay, so what are the types of hepatitis? First is acute hepatitis and chronic hepatitis. When do we say it is a acute hepatitis? When it lasts for less than 6 months. Okay, if it is less than 6 months, if the duration is less than 6 months, then it is acute hepatitis, and if it is more, then we call it as chronic. So our basic demarcation is 6 months. If it is less than 6 months, it is acute. If it is more than 6 months, it is chronic. Okay, so these are types of hepatitis according to duration. Okay, according to duration, these are the types of hepatitis. Now, what are the causes of hepatitis? The causes of hepatitis are, first is viruses. They are most common causes. Then other causes are toxic substances. One of the most common is alcohol. Medications are there. Industrial organic solvents, infections, and autoimmune disease. Okay. Now, what do you mean by autoimmune disease? Autoimmune disease means our own cells, body cells, they will be attacking the healthy cells, our own body cells. Okay, so the body cannot differentiate between foreign and own body cells. So autoimmune is our own body cells, they start fighting with our own healthy cells. Okay, so that is called as autoimmune diseases. Now we have different causes of hepatitis. Okay, causes of hepatitis, it is a continuation of the causes. We have different types of hepatitis virus, which are called as A, B, C, D, E. Okay, so these are all hepatitis virus. Hepatitis A, hepatitis B, C, D, and E. So these are all hepatitis virus. Apart from the virus, some bacteria are also responsible, like anaplasma and nocardia. So these are the common bacteria which cause. Next is alcohol and autoimmune disease, in which SLE, that is systemic lupus erythematosus. SLE comes under autoimmune conditions. So in this, hepatitis is there. Drugs. What are those drugs? Paracetamol, amoxicillin, anti-tuberculosis medication, minocycline, and many others. Many of the medicines, they are we use the word hepatotoxic. Hepatotoxic means they harm the liver. Okay, so this may be paracetamol, amoxicillin, anti-tubercular, that is ATT, then minocycline, and many others. Apart from that, we have ischemic hepatitis, where there is circulatory insufficiency in the liver. So that is called as ischemic hepatitis. Now we shall study the types of hepatitis. First is hepatitis A. Okay, in hepatitis, usually the question comes on what are the types of hepatitis. So we shall be studying basically the types of hepatitis. So first is hepatitis A, caused by hepatitis A virus. Okay. Next is hepatitis A is one of the most common type of viral hepatitis, and it is generally seen in those areas where sanitation and sewage disposal are poor, जहाँ साफ सफाई नहीं है. Okay, so there hepatitis A is common. दूसरा है sewage disposal. Okay, sewage disposal is, suppose if you have some leaking, suppose if the sewage line has leaking, it comes in contact with drinking water. So in that way also the hepatitis A can occur. Or if the sewage is the sewage treatment is not done properly. Okay, हमको मालूम है sewage has to be treated. ठीक है, so if that is not treated properly, this can cause a problem. Okay, and commonly spread through fecal oral route. Fecal oral route मतलब feces से निकला. Okay, somebody has hepatitis A virus, feces में it comes out, and then somebody ingested the contaminated food and water. ठीक है, so those food and those water which has been contaminated with hepatitis A, if somebody, ingestion means somebody eats, So this causes hepatitis A. Next is, it is usually a short term or acute. Short term we have already studied, that is less than 6 months, and its symptoms pass away within 3 months. Okay, so that is the duration of hepatitis A. Hepatitis A, what are the things we have studied? First is, it is caused by hepatitis A virus. Second is, most common type. Third is, it is present in those areas where sanitation and sewage disposal are not so good. It is spread through fecal oral route, and this has a duration of approximately 3 months. Now, there is no specific treatment of hepatitis A other than, depending on if pain is there, you give ibuprofen. Okay, then we have hepatitis A vaccination, so that can be given. So vaccination is recommended if a person is traveling to country where virus is common. For example, India, Africa, Central and South America, Far East and Eastern Europe. Suppose if you have to travel to any of these countries, then hepatitis A vaccination is mandatory. Okay. Now we'll come to hepatitis B. All of you must be vaccinated with hepatitis B vaccination. So these are the details. They are caused by hepatitis B virus. They are present in blood, and they are also present in body fluids. And what are these body fluids? Semen and vaginal fluids. So somebody who is having multiple sexual contacts with different people, so they are at risk of hepatitis B. Okay, so it is generally spread through unprotected sex or by sharing needles to inject drugs, or if you are sharing needles, injecting drug users are there. If some people are there who are taking drugs through injections, because it is very costly, so what they do is they use the same syringe and inject to 3-4 people. So in that way also hepatitis B spreads. Okay, so it is common in drug users, and it is common in India and other parts of the world like China, Central and Southeast Asia, and Sub-Saharan Africa. Now hepatitis C. Hepatitis C is caused by hepatitis C virus. Okay, it is found in blood, and very less amount in saliva, semen or vaginal fluid. Okay, so it is usually caused through blood to blood contact, and it is concentrated in blood. Okay, that is why it is through blood to blood contact. Okay, if you have hepatitis C, then no noticeable symptoms are there, or symptoms that are mistaken for flu. Okay, so the people may think that they have flu. They may not check with whether hepatitis C is there or not. Okay, so hepatitis C, so what are the flu symptoms? Flu symptoms can be fever, chills, muscle ache, a mild cough, maybe running nose, headache, fatigue. So these are flu symptoms. Okay, these are flu symptoms. What are those flu symptoms? Maybe fever, chills, muscle ache, cough, running nose, headaches and fatigue. So these are the flu symptoms, and people may mistake it as flu, and they may not even know that they are infected with hepatitis C virus. Okay, now many people fight off the infection and will be free. Okay, so hepatitis C virus is not much of issue. In remaining, many people the hepatitis C will be cured, but in some people the virus might stay in the body for many years, and this is known as chronic hepatitis C virus. So this is hepatitis C virus. Okay, now chronic hepatitis C virus, for this you have to take antiviral, and we don't have any vaccination for hepatitis C. Now we have another hepatitis which is called as alcoholic hepatitis. Okay, alcoholic hepatitis. So from the word itself you can see that this occurs in those people who are taking alcohol for long period of time. Okay, so this causes hepatitis which is called as alcoholic hepatitis. Okay, so there are no symptoms, but it is often detected with blood test. Okay, so blood test can reveal whether a person has alcoholic hepatitis, and if anybody has alcoholic hepatitis and he continues to drink alcohol, then there is a great possibility that he may develop cirrhosis of liver or maybe a liver failure. Okay, so alcohol badly damages the liver. Okay, so this starts with alcoholic hepatitis, and once the person is detected as alcoholic hepatitis, and if he still continues to take alcohol, so this can convert to cirrhosis or maybe liver failure. Okay, now next is hepatitis D virus. What is hepatitis D virus? It is present only in those people who are already infected with hepatitis B. So those people who are infected with hepatitis B virus, they can have the chance of developing hepatitis C virus, because hepatitis D virus needs the presence of hepatitis B virus to survive in the body. Okay, so if this virus has to survive, hepatitis B virus has to be there. Okay, so those people who have hepatitis B virus need to be checked whether hepatitis D is there or not, and vice versa. Next is hepatitis E virus. Okay, so hepatitis E caused by hepatitis E virus, it is mild and short term, spread to fecal oral route, and person to person transmission is very rare. Okay, now we have another hepatitis which is called as autoimmune hepatitis. It is called as autoimmune hepatitis. So here it is long term. Okay, very rare cause of chronic or long term hepatitis. The WBC cells attack the liver, causing chronic inflammation and damage. Okay, so autoimmune, I was telling that autoimmunes are those diseases where our own body cells, they attack our own healthy cells and they cause diseases. So here WBC, they attack the liver and they cause chronic inflammation damage. This leads to autoimmune hepatitis. Okay, so this can even cause liver failure. And what are the symptoms? Tiredness, pain in abdomen, joint aches, jaundice, and cirrhosis. Okay, so these are the signs and symptoms of autoimmune hepatitis: tiredness, pain in abdomen, joint aches, jaundice, that is yellowish discoloration, and cirrhosis. Okay, so treatment, we have to give medicines which will suppress the immune system, so that is why reduce inflammation. So we give steroids for these people, and this has to be given for several weeks, and this controls the symptoms also. Now, what are the symptoms of hepatitis? Initial symptoms of hepatitis are muscle pain and joint pain, fever more than 38 degrees centigrade or 100 degrees Fahrenheit, feeling unwell, headache, and occasionally there will be jaundice. Okay, occasionally, can you see this yellowish discoloration? Okay, so this hepatitis jaundice also can be there. So muscle and joint pain, high temperature, feeling unwell, and headache. So this is the yellowish discoloration of the eye. Chronic hepatitis is feeling tired all the time. There will be jaundice, there will be depression, and the person will not be feeling well at all. Now we'll come to diagnostic tests. Okay. Now first is because hepatitis is inflammation of the liver, so naturally the liver enzymes are going to be affected. Okay, so liver enzymes, what it is written, 4 to 10 times the normal values. Okay, so liver enzymes will be more than 4 to 10 times. Okay, 10 guna jada values, so that is 4 to 10 times the normal values. Now we are going to study. So if you check, first is you check the liver values, they will be more than 4 to 10 times. Second is AST and ALT. Now what is AST? AST is aspartate, 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 aspartate transaminase, that is AST, aspartate transaminase, and ALT is alanine transaminase, alanine, ALANINE, transaminase, TRANSAMINASE. Okay, so aspartate transaminase and alanine transaminase, AST is also called as SGOT, and ALT is also called as SGPT. So these are the common names what we usually see in our lab test in the ward: SGOT and SGPT. Okay, so SGOT is nothing but AST, and SGPT is ALT. Now what is the full form of SGOT? Serum glutamic oxaloacetic transaminase. Serum glutamic, GLUMATIC, that is glutamic, acetic, ACETIC. So SGOT is serum glutamic oxaloacetic transaminase. And what is SGPT? Serum glutamic pyruvic transaminase. Pyruvic, PYRUVIC, pyruvic transaminase. Okay, so serum glutamic oxaloacetic transaminase and serum glutamic pyruvic transaminase. Okay, so here is, we usually check the ratio, AST ALT ratio. Okay, AST ALT ratio normal is less than 1. Normal kitna? Less than 1. But in alcoholic hepatitis, this may be more than 1, and this may even cross 2. This may be more than 1. Less than 1 is normal. This will be definitely more than 1, and in some cases it is even more than 2. So this is strongly suggestive of alcoholic hepatitis. Okay, next is alkaline phosphatase. Okay, so alkaline phosphatase is an enzyme which helps to break down proteins. Okay, and it plays a very important role in liver functions. Okay, alkaline phosphatase, it is an enzyme which breaks down proteins and plays an important role in liver function. Okay, so if you have increased alkaline phosphatase, this indicates that hepatitis is there, or liver is not functioning properly. Okay, now we'll come to hepatitis A, B, C, D, E. To check which type of hepatitis it is, we have panel. A, B, C, D, E panels are there. So these are antigen antibody tests are there. So we can take a blood test, and with one sample we can check for all these things. Okay, so we have a panel of hepatitis A, B, C, D, E. So depending on the findings, we can identify which type of hepatitis it is. Okay, next is CBC, that is complete blood count. And here they are basically concentrated on RBCs. Okay, in CBC, one thing is there. In hepatitis B, the WBC will be less. Okay, in hepatitis B, WBC is less. Okay, so WBC is less means it is called as leukopenia. It is called as leukopenia. Okay, so apart from that, RBCs also will be changed. Okay, so RBCs may be decreased because of shortened RBCs. Okay, so we know that the normal lifespan of RBCs is 120 days, but in small children, we have already discussed in physiological jaundice that they are because of the fetal RBCs, they are less. But here, even if hepatitis occurs in bigger children, where you don't have fetal hemoglobin, there you will find that the lifespan of RBCs is shorter than 120 days. Why? Because of the liver enzyme alterations. Okay, now we'll come to WBC count. First is leukopenia. What is leukopenia? Low WBC count. So low WBC count is present in hepatitis B. Then is leukocytosis, that is increased WBC count. So leukocytosis, the increased WBC count, this is common in alcoholic hepatitis. Okay, so leukopenia, that is low count in hepatitis B, and leukocytosis, that is higher count of leukocytes, they are present in alcoholic hepatitis. Okay, next is monocytosis. Monocytosis, that is increased monocytes, they are present in chronic liver failure or maybe due to alcohol hepatitis. Okay, so monocytosis is present in chronic liver failure or maybe with alcohol hepatitis. Okay, next is atypical lymphocytes. What are atypical lymphocytes? This lymphocyte, we know that lymphocytes are type of WBC. Size of WBC will be more. Okay, size of lymphocyte will be more. That is called as atypical lymphocytes. So atypical lymphocytes are common in hepatitis B. Okay, so what you will find that the size of the lymphocytes is increased. So this finding is common in hepatitis B. Next is plasma cells. So plasma cells, we also have a type of hepatitis which I have not dealt, but it is a rare type. It is called as plasma cell hepatitis. So this commonly this occurs in young girls, and in this type we will find that plasma cells have increased. Okay, plasma cells have increased, and those girls who have plasma cell hepatitis, they will have amenorrhea, obesity, skin rashes, and mild to moderate to severe liver damage. Okay, moderate to severe liver damage. So plasma cell hepatitis is there, which occurs in young girls, and in these girls you have symptoms of amenorrhea. Amenorrhea means the periods have not started. Okay, then obesity, skin rashes will be there, and there will be moderate to severe liver failure. Okay, the remaining diagnostic tests are serum albumin. Okay, so this will be decreased. Blood glucose, you may have transient, that is for short time, either hypoglycemia or hyperglycemia, because liver helps to store the glucose. Okay, because then because of these issues the liver is not functioning properly, so you may have either hyperglycemia or hypoglycemia. Prothrombin time will be more because of liver dysfunction. Serum bilirubin, that they will be above 2.5 milligram per 100 ml. Okay, so this may be the value. If it is above 200 milligram per 100 ml, poor prognosis because of increased cellular necrosis. We have already studied that inflammation of the liver, they cause degenerative changes as well as necrotic changes. So if it is about 200 milligram per 100 ml, then it denotes the necrotic stage of the liver. Then is liver biopsy. What do you take? Biopsy means you take a piece of the liver and check. Okay, so usually it is not needed, but if it is diagnosis is not certain, then we do go for liver biopsy, but usually it is not required, because we have hepatitis panel which can identify hepatitis and other tests. And urine analysis, we can check bile salts and bile pigment. Elevated bilirubin levels will be there, and protein or hematuria may occur. Okay, so these are the different diagnostic tests. This is how the liver is taken. See, this is liver is in the right side. So what you do is you introduce a needle and take out a small piece of liver. Okay, and then you check. So this is a diagram of liver biopsy. Now is pathophysiology of hepatitis B. Okay, hepatitis B, I just wanted to have a short description of hepatitis B. Hepatitis B virus is constructed of an outer capsule which contains hepatitis HBsAg. It is called as HBsAg. So what is the full form? Hepatitis B surface antigen. Okay, it contains HBsAg is hepatitis B surface antigen. Inner core containing HBcAg, that is HB virus, HBV core antigen. Okay, so C stands for core, here S stands for surface antigen, C stands for core antigen, and then we have HBe antigen, that is hepatitis B antigen. Okay, so these are the parts of hepatitis B virus. So our main area is as the blood becomes exposed to hepatitis B virus. So whenever suppose if you don't check the blood, and if blood transfusion is given of a person who has hepatitis B, and if that is given to others, so that way, or maybe due to sexual contact, the hepatitis B virus enters inside the body. Okay, so whenever it enters inside the body, this initiates a cell mediated immune response. Now what is cell mediated immune response? We have two type of immune response. One is humoral and second is cell mediated. Humoral is use of antibodies. Okay, humoral का क्या मतलब है? एंटीबॉडीज के द्वारा. इसमें एंटीबॉडीज यूज नहीं करते हैं. सेल मीडिएटेड मतलब बिना एंटीबॉडीज का. तो सेल मीडिएटेड मतलब कैसे आप करोगे? फैगोसाइट्स के द्वारा. देन वी हैव साइटोटॉक्सिक्स, टी लिम्फोसाइट्स, साइटोकीन्स, ये सब जो है cell mediated immune response है. So whenever you have hepatitis B virus, the body initiates a cell mediated immune response by sending cytotoxic T cells and natural killer cells to the virus and release inflammatory cytokines. Okay, तो body क्या करता है? hepatitis B virus से लड़ता है by cell mediated immune response. कैसे? They send the cytotoxic T cells, natural killer cells and inflammatory cytokines. ये तीनों तरीके से cell mediated immune response start होता है. Okay, the greater the immune response, the greater is the chance for virus. ठीक है, अभी जब हमने 3 तरीका पढ़ा, अगर वो अच्छा रहेगा, naturally the virus can be fought properly. ठीक है, then as hepatocytes are attacked and infiltrated by hepatitis B virus, इसमें कौन सा आता है? ग्राउंड ग्लास. ओके, हिस्टोलॉजिकल एग्जामिनेशन में हेपेटाइटिस बी अगर किसी को है, सो दिस हैज़ अ ग्राउंड ग्लास. जैसे फॉर एग्जांपल लिवर बायोप्सी आपने किया है, यू कैन सी दिस इफ इट इज़ ड्यू टू हेपेटाइटिस बी वायरस. ओके, सो दिस इज ड्यू टू हेपेटाइटिस बी ग्राउंड ग्लास अपीयरेंस है. इन हिस्टोलॉजिकल एग्जामिनेशन मतलब सेल के एग्जामिनेशन due to HBS antigen. HBS मतलब surface antigen. So this surface antigen infiltrates the cell cytoplasm and this is how you differentiate hepatitis B from other forms. ठीक है, clear है? hepatitis B virus है तो cell mediated immune response आएगा. So hepatitis B virus अगर है तो so what happens is cell examine करते समय liver biopsy करके cell आप चेक करेंगे तो ग्राउंड ग्लास अपीयरेंस आता है. क्यों ग्राउंड ग्लास आ रहा है? बिकॉज सरफेस एंटीजन HBS सरफेस एंटीजन इन्फिल्ट्रेट्स मतलब लिवर के सेल के साइटोप्लाज्म में घुस जाता है. सो दिस कॉजेस ग्राउंड ग्लास अपीयरेंस. ओके, सो बिकॉज हेपेटोसाइट्स आर कंटिन्यूअली proliferating the virus is constantly being shed into the blood which contributes to chronic infection. ठीक है, ये हेपेटोसाइट्स में ये वायरस बढ़ते जाता है एंड फाइनली इट एंटर्स द ब्लड स्ट्रीम एंड कंट्रीब्यूट्स टू क्रॉनिक इन्फेक्शन. ओके, सो दैट वाज ऑल अबाउट द डिफरेंट टाइप्स ऑफ हेपेटाइटिस and what are the signs and symptoms, what are the diagnostic tests we have studied. In the next class we are going to study about the nursing care plan of hepatitis. So thank you for a patient listening. Thank you.